Hello everyone, welcome to my channel of Aesthetic Physio. So in this series of pharmacology, the next topic is obstructive airway disease, which comes under respiratory pharmacology. So the obstructive airway disease, they have some type like COPD, asthma, and bronchitis. So let's understand about how the airways blockage occur and different conditions. So a chronic respiratory condition characterized by airflow limitation. So the airflow limitation is to be low, slow down, or like any kind of obstruction. So you have not filled your lung completely, like fluid accumulation or like bacterial or like viral infection in your lung. It causes narrowing of airways, leading to breathing difficulties, wheezing and coughing. So there is have different kind of lung sound, wheezing and coughing sound, and due to the narrowing of airways of the windpipe of our body part. The first is to be COPD, like chronic obstructive pulmonary disorder, often linked to smoking, comprising chronic bronchitis and emphysema. So COPD is a condition is like linked to be the chronic bronchitis and emphysema due to occurs to be like chronic smoker or chain smoker like person. Next is to be asthma. Asthma is a reversible airways obstruction. It occurs due to like any kind of obstruction which came in our airways, and it can't be treated, and it will be a reversible process, but long term exposure of to pollen grains or any kind of like dust particles. So asthma is the like severe condition, patient have insufficient to take oxygen by their nose and like mouth. So on that condition they have taken inhaler or asthma inhaler for the respiratory, it will be open into bronchi, like dilate over there. Next is to be the bronchitis. It's a chronic dilation and inflammation of the bronchi. Is it, it's it is occur to the bacterial infection, and if bacterial infection is to be there, so the inflammation symptoms over there and accumulation of the fluid over there. Next to be cystic fibrosis. The cyst occur into the lungs, which is occur due to the hormonal changes, genetic conditions causing among other issues severe airways obstruction. So hardening of this like lung muscle, or also the cyst formation into the lungs. Symptoms: productive cough, wheezing, shortness of breath, chest tightness. So these symptoms have to be shown on the patient if there has chronic obstructive disease. Next is to be pathophysiology. So pathophysiology of chronic obstructive disease is to be airway inflammation. Any kind of bacterial and viral infection occur into your lungs. Also occur like take one example in tuberculosis, mycobacterium tuberculi, that cause infection over there and inflammation. Next is to be bronchoconstriction. The inflammation has to be caused bronchoconstriction, and mucus is to be accumulate over there, and it cause airways remodeling. So it will be change the shape of the bronchi, and it will be difficulty to patient to inhale oxygen into their lung. So on this this pathophysiology, there have to be drug have to be used is to be bronchodilators, which is beta agonist. The example of beta agonist is salmeterol or terbutaline. These two medication help to open or like dilate into the constriction of the bronchi into our lungs. So the salbutamol have to bronchodilation. It attack into attack over the B2 cell, which is present in our bronchi. It will be constrict over there, and after that it will be action and it will be dilate over there. Next is to be side effects. So if you are like regular take the salbutamol and terbutaline, these two medications, so the tachycardia, tremors, palpitation, or hypokalemia if have to be shown. So that is a chronic obstructive pulmonary disorder. Thank you.